Bismillahirrahmanirrahim. Today we will talk about one of the very important exam station, which is counseling. It comes in your IMM exam, FCPS Part 2 exam, in any of the field, not particularly the gynae. But I will more talk about the gynae and OPS exam, whether it's FCPS or IMM. However, this video will be for everyone who wants to pursue the preparation for any of the exam of any related field of exit exam of CPSP or any one other exam. The major points for the counseling includes you should be confident, you should read the scenario very carefully. Please don't panic. There is not much of the problems or difficulties that lies in reading the scenario. Please read the scenario very carefully or twice if you do not comprehend that, and then start the counseling. Make a blueprint in your mind and then start. Utilize your body language while doing the counseling. It is one of the very important factors of your exam assessment. You can note to the patient, you can say, I am sorry to hear that, add additional words and the languages. More importantly, listen patient very carefully. You should listen to the patient's words and their comprehensions and their concerns and then respond according to them. The patient or the role player in exam will lead you to your direction of your station if you just got deviated. While in abroad exams, if there are any props, they usually use them in their counseling station. For example, while in the Breaking Bad news station, there is a cup of water or a glass of water there or a tissue box there. So use the props or any paper or pencil there. So just use the paper and pencil to draw any other diagram needed for your counseling station, or use the props like tissue box or cup of water for the patient in Breaking Bad news. Draw if necessary, but you should know that never ever draw the anomaly in anomalous baby counseling station. You should not draw that anomaly for the mother, and be empathize. You will be assessed in this station on the basis of patient safety, communication with the patients and families, information gathering, and applied knowledge. In the patient safety, that comes the part introduction, greeting, introduction of the patient, confirm the record given of the patient. The exam candidates usually do the mistake of not confirming the record given of the patient, of especially during the Breaking Bad news, and they just start their station. So please do not do that. If you are fail in patient safety, you are overall fail. The important steps, these are very easy and basics. So how to start and how to end the counseling station. In between that part, you should apply your knowledge, which comes in the category of applied knowledge. So start with the greeting, 0.5 marks of each step in your exam of these portion. So greetings, start with the greetings, then introduce yourself, ask the patient for their introduction, call for the attendant if necessary. Remember, except HIV, while breaking the bad news, you should ask or call for the attendant, whether a husband, a family member, or anyone else that comes along with the patient. But do not wait for the attendant to come, because in exam they will not come. Just say and move forward. The next step is ask the patient what you know about your disease or the report if given in your exam scenario. Quickly take a brief history and then ask or just say that I have to examine you for this particular problem, and then we will proceed. Don't examine in the station, but just say that if it is necessary in some of the stations, like in any mass or any other thing. Explain the report and disease very empathetically to the patient. Ask the questions in between like, do you get it? Are you getting my point? क्या आपको समझ आ रही है मेरी बात की? जहां ना समझ आए मुझे बता दीजिएगा, मैं दोबारा बता दूंगी. Share the decision plan. Never ever impose any of your decision or plan to the patient, and always says there are few options for your management regarding your case, and these are then you can discuss with your family and then come again to me so that we can pursue with that particular management. Always have a shared decision plan. Never impose any of the management plan to the to your role player or patient. In the end, give the hands out, the sports groups or different websites links which will be helpful for the patient for that particular disease. Always say that this is the contact number of the hospital, of your clinic, of you, of a doctor in case of any emergency, and say thank you at the end. So let's practice these things and in how to perform this in the exam station. I will start with the greetings. Assalamu alaikum. Pause. Let the patient answer your greetings and say Walaikum Assalam and then move forward. मेरा नाम डॉक्टर आयशा है, मेरा ताल्लुक गायनी के शोबे से है, मैं आज आपकी डॉक्टर हूँ. A brief pause and then आपका नाम या फिर क्या मैं आपका नाम जान सकती हूँ? Patient will say their name. Always use the miss that patient word. And then say okay Miss XYZ. मैं आपके मसले के बारे में तफसीलन बात करूंगी. मुझे उम्मीद है कि आप मेरे साथ ताउन करेंगी. अगर कोई बात समझ में ना आए तो आप पूछ सकती हैं. A little pause and then say again. तो मिस XYZ, आप अपनी बीमारी के बारे में क्या जानती हैं? और if it's any breaking bad news, then you can say that तो मिस XYZ, आपको अपनी रिपोर्ट के बारे में क्या मालूम है? Do not use the medical jargons. Be easy while you are talking to a layman and then proceed. This is the start of your counseling station. And while starting, you will gain each and every point or marks of each and every step if you follow all these lines. So afterwards, just use the applied knowledge of that particular topic and then proceed forward. Please talk about the facts and the figures which are evidence-based in your exam. And while talking, for example, while doing the performing the feedback station, just say that 75% of the people have a successful feedback outcome. Or talk about either the percentage or 1 in 200, 1 in 1000, 1 in 10,000. This is the incidence. ताकि लोगों को समझने में आसानी रहे. In the end, these are 0.5 or 0.25 marks of each of the steps. And in the end, you should say that आपके ताउन का बहुत शुक्रिया. आपकी बीमारी या मसले से मुतालिक ये कुछ पम्फलेट मौजूद हैं. Just have your acting skills to pass this pamphlet to the patient. And और कुछ स्पोर्ट ग्रुप्स भी हैं जो आपकी रहनुमाई कर सकते हैं. स्पोर्ट ग्रुप्स क्या होते हैं कि बाहर के कंट्रीज में जो आपकी पर्टिकुलर डिजीज है, फॉर एग्जांपल थैलेसीमिया, उससे रिलेटेड स्पोर्ट ग्रुप्स लाइक आइदर इन द फॉर्म ऑफ एनी द सोशल मीडिया लाइक व्हाट्सएप, टेलीग्राम, फेसबुक, तो वो सब ग्रुप्स बने होते हैं. तो वहां पे उस जैसे ही लोग मौजूद होते हैं उस बीमारी से रिलेटेड. तो लोगों के लिए इजी होता है उनसे बात करना, उनसे पूछना कि अच्छा आपने ये डिजीज को कैसे परस्यू किया था. तो दिस इज द सपोर्ट ग्रुप्स जो बाहर यूज होता है. पाकिस्तान में भी ये ट्रेंड आना शुरू हो गया है बट अभी इतना कॉमन नहीं है. बट यू कैन से दैट कि ये कुछ सपोर्ट ग्रुप्स हैं जो आपकी रहनुमाई कर सकते हैं. ये हमारे अस्पताल का नंबर है. आप किसी भी मालूमात के लिए राब्ता कर सकती हैं. किसी इमरजेंसी की सूरत में फौरन अस्पताल तशरीफ लाएं. आपके आने का शुक्रिया. आप अपने और एंड अगर कोई मैनेजमेंट से रिलेटेड है तो आप कह सकते हैं कि अपने घर वालों से मशवरा करके, अपने खावन से मशवरा करके आप मेरे पास दोबारा किसी भी टाइम आ सकती हैं, मैं यहाँ पर आपके लिए मौजूद हूँ, एंड से थैंक यू। So these are the start and the ending lines, which have the pet marks, and you can get them easily if you follow all these. So what you should do in your counseling station: break the ice. The ice stands for ideas, concern, expectations. So listen to the ideas of the patient, deal with their concerns, make sure you are up to with the expectations of the patient. So this ICE is necessary for passing in your counseling exam station. Another thing is the appropriate responses. Whenever patient feels difficult to say anything, shy, you should encourage them. You should encourage them while you're with your body language, or by saying the minimal words. Yes, you can say that. और आप कह सकती हैं, आप बताएं मैं यहाँ पे मौजूद हूँ, आप परेशान ना हो, आपकी प्राइवेसी को मद्देनजर रखा जाएगा। और बाकी चीजें कि और मुझे अगर कोई ब्रेकिंग बैड न्यूज है पेशेंट कुछ बताती है कि मैं बहुत परेशान हूँ, तो आप उसको कह सकती हैं कि मुझे बहुत अफसोस हुआ सुनकर, आई एम सॉरी टू हियर दैट। मैं समझ सकती हूँ आपके मसले जो हैं, वो उसका इलाज हम प्रॉपर देखकर करेंगे, आप परेशान मत होइएगा। एंड देन शेयर फैक्ट्स, ऑलवेज एंड ऑलवेज इन द एग्जाम शेयर फैक्ट्स। उसमें क्या चीज आती है कि सपोज कोई इंसिडेंस है, वीबैक का, थैलेसीमिया का, प्रेगनेंसी का, थैलेसीमिया का, जेनेटिक इनहेरिटेंस का, ये सब चीजें आपने सादा आम जुबान में परसेंटेज में या फिर 1 in 100, 1 in 1000 इस तरह करके बतानी है इजीली। तो आपको ये सब फैक्ट्स एंड फिगर्स याद होने चाहिए मेजर काउंसलिंग स्टेप के। ये सब आपको स्टेशन के फैक्ट्स एंड फिगर्स पता होने चाहिए।